The big story, e-cigarette epidemic.
A massive crackdown on teenage vaping and the businesses illegally selling to minors.
In Metro Detroit alone, about 40 stores in 25 cities were issued fines or warnings.
This coming in light of an alarming new survey. It shows that 1 in 5 high schoolers use tobacco and that the most widely used product by far is e-cigarettes. Many kids under the false impression that vaping doesn't pose a health risk. Our Dr. Nandi busts those myths in just a moment.
But our big story begins with 7 Action News reporter Amira David live in Oak Park to take you inside this massive crackdown. Amira.
That's right. Well, here's that list. 68 Michigan retailers illegally selling to minors between the months of June and September, including this location of 7-Eleven right here on Coolidge Highway in Oak Park.
Obviously, it's a real problem if they're stepping in.
You know, all they're looking for is to make that money.
That's what these Metro Detroiters had to say when I showed them this offenders list. 68 retailers either getting a warning or a ticket for selling to minors, over 30 of those under fire right here in Metro Detroit. Are you relieved to see the FDA is cracking down?
Yeah.
One of the sites on the list, this 7-Eleven in Oak Park on Coolidge Highway. It was fined after ignoring an initial warning by the FDA. I went in to ask if they were taking that fine seriously and didn't get a response. But the FDA likely will, as it gets serious with vendors like these, along with big industry manufacturers, all while jump-starting a new prevention campaign.
There's an epidemic spreading. Scientists say it can change your brain.
In the last several months, the FDA has grown increasingly concerned by the high use of harmful e-tobacco products by kids as young as 12 years old.
These products contain nicotine. Nicotine can rewire your brain, put you at risk of becoming addicted. The aerosol can contain things like formaldehyde.
The FDA says research shows nearly 45% of Michigan high school students admit to having tried e-cigarettes, e-cigars, vaping, or hookah pens.
In Michigan, it's actually higher than the national average of 42%.
It's a percentage that has skyrocketed as manufacturers of popular products like the Juul are accused of targeting young teens with kid-friendly flavors. So what do parents need to know? That it's vital to have a conversation with your kids.
It really does help for the parents to stay involved, and no matter what they are. I always say, if I don't say it, then you don't hear it.
And that's exactly what the FDA wants parents to do. Get educated, then have an honest conversation with your kids about the dangers. For now, live in Oak Park, Amira David, 7 Action News.
That conversation, the best remedy. Thank you so much, Amira. Now, many people seeing e-cigarettes as harmless, but that really isn't the case.
That's why we brought in our chief health editor, Dr. Nandi, to talk about the health concerns e-cigs pose to children. Doc?
See how it's confusing to folks as e-cigarettes are marketed as to adults as a way to stop smoking, so it would seem like common sense, right, to view them as a healthy alternatives to real cigarettes. But what many people don't realize is that these products usually contain the same addictive drug in cigarettes, and that's nicotine. And on top of that, users can breathe in other harmful substances like cancer-causing chemicals, heavy metals like nickel and lead, and a chemical linked to lung disease called diacetyl.
So are e-cigarettes products more harmful to teens?
It's a great question, Glenna. So the CDC, this is what they say, that they're unsafe for kids, teens, and young adults. Now here's what's concerning, is that nicotine can negatively affect brain development. It can harm areas that control learning, attention, impulsivity, and mood, all important. And also research also found that kids using e-cigarettes, guess what, were more than 7 times more likely to start smoking cigarettes. And that's bad news.
All right, so aside from shouting from the mountaintop,
what
can we do to prevent teens from using e-cigarettes, Doc?
It's a great question. You should shout from the mountaintop, but first of all, you should set a good example. So if you smoke, it's a great time to quit. Also, please talk with your child about the harmful effects of not only e-cigarettes, but all tobacco products. And make sure it's an open-ended dialogue and not a lecture. And also encourage your teens to learn the fact themselves, right? Because they learn better themselves by visiting the CDC's website at cdc.gov. And if you're uncomfortable with this, please go to your family doctor or your regular doctor to talk to your child as well. Really important. We got to get the information out there and let kids and parents know what's going on.
So that perception that it's safer, you're telling us it's not, Dr. Nandi. We thank you so much for
100%.
your update. And for a closer look at the FDA's The Real Cost campaign for helping keeping your family smoke-free, please visit our website, WXYZ.com. Email any questions to Dr. Nandi at WXYZ.com.